Why is invasive lobular carcinoma, ILC, so hard to diagnose? Imagine trying to find a tiny, sneaky pattern in a busy fabric. That's similar to how invasive lobular carcinoma, or ILC, can hide in the breast. And like other types of breast cancer, ILC grows in a way that makes it tricky to spot early. It doesn't usually form a big, noticeable lump like some other cancers do. Instead, it spreads in a subtle, linear pattern, almost like thin strands of hair weaving through the tissue. This growth pattern is called diffuse infiltration, and it can be so gentle that it doesn't cause obvious changes in the breast. Because of this, physical exams often miss ILC. Doctors might not feel a lump during a routine check because there isn't a distinct mass to feel. Standard imaging tests like mammograms can also be less effective. Mammograms work well when there are clear calcifications or lumps, but ILC usually doesn't produce those. Instead, it quietly infiltrates the tissue without leaving many visible signs on a mammogram. Ultrasound scans may not pick up these diffuse strands either, because they're too subtle to stand out. Magnetic resonance imaging, or MRI, tends to be more sensitive for ILC, but it's not always used as the first test. Another reason ILC is hard to diagnose is because of its molecular makeup. It often involves the loss of a gene called CDH1, which encodes a protein called E-cadherin. E-cadherin helps cells stick together, so when it's missing, the cancer cells spread out more loosely and infiltrate the tissue in a scattered way. This makes the tumor less likely to form a clear, detectable lump. ILC also tends to be multifocal, meaning it can appear in multiple spots within the same breast, or even in both breasts at the same time. This adds to the challenge of finding and diagnosing it early. Because of these factors, doctors usually need to use a combination of approaches to diagnose ILC accurately. A biopsy, where a small tissue sample is taken and examined under a microscope, is essential. Pathologists look for specific markers, like the absence of E-cadherin, to confirm the diagnosis. Sometimes additional tests, such as checking for other proteins, are used if E-cadherin isn't available. Advanced imaging techniques like MRI or specialized scans can help reveal areas that might look normal on a mammogram but are actually affected by ILC. The tricky growth pattern of ILC often means it's found at a later stage, sometimes after it has already spread to other parts of the body, like bones or the gastrointestinal tract. That's why awareness of subtle signs and symptoms, such as unexplained bone pain or digestive issues, can be important clues for doctors. In summary, invasive lobular carcinoma is hard to diagnose because it grows in a diffuse, non-mass-forming way that doesn't produce typical signs on physical exams or standard imaging. Its molecular features and tendency to be multifocal or bilateral make detection even more complex. To improve diagnosis, healthcare providers relying on a combination of advanced imaging, biopsy, and molecular testing. If you or someone you know notices unusual changes in the breast or has concerns, it's always best to consult a healthcare professional who can recommend the appropriate tests and provide personalized guidance.